Hi, my name is Manuel Loja. My topic is Eggshell calcification of the bladder. Definition: the bladder is a expandable muscular sac that restricts urine before it is excreted of the body through the urethra. It is located in the lower abdominal area near the pelvic bone. Calcification is typical of chronic genitourinary and gastrointestinal schistosomiasis, in which the larvae of the schistosoma parasitoid are deposited of the wall of the organs and become calcified.
45-year-old male presented with occasional cough and breathlessness. Mediastinal window showing eggshell calcifications of the lymph nodes in pretracheal region, subcanal region, and also you can see the calcified lymph nodes in the right hilar region. So these are showing peripheral calcification. Some are showing arc-like calcifications. In generally in silicosis, the mediastinal and lymph nodal findings precede the lung findings sometimes. Lung may show some amount of fibrosis. We can see the fibrosis in right upper lobe. Nodules may be seen, occasional nodules may be seen, one or two nodules we could see, but they are not typical lymphatic distribution of the nodules. So this is a typical eggshell calcification. Here it is continuous in one lymph node and the lymph node was greater than 1.2 centimeters. So this is complete ring-like calcification in the pretracheal group of uh, pretracheal lymph nodes. So Jacobson et al. Have published some criteria so to avoid overreading of eggshell calcifications. There should be 2 mm thickness. The calcification, if you can see, if you can measure it, it should be 2 mm thickness. Calcification should be solid or broken, and central part may show other calcifications. One affected lymph node should be greater than 1 cm. All these criteria are fulfilled in our case. So this is a classical case of eggshell calcification. Eggshell calcification can be seen in silicosis, sarcoidosis, Kohlwerker's pneumoconiosis, lymphoma post-RT, scleroderma, amyloidosis, blastomycosis, and histoplasmosis. Last two are very uncommon in developing world. Tuberculosis can show eggshell calcification sometimes. Most common being silicosis. Most of the times, silicosis is one of the most common cause of followed by sarcoidosis. Thank you very much. Hope this video was useful for you.
Application in medicine. A 43 years old man presented with a 1 month history of dysuria and intermittent hematuria. Similar episodes had occurred several times in the 6 month presentation, along with episodes of rectal bleeding. Laboratory investigation revealed elevated albumin creatinine with dysmorphic results in the urine. A serum schistosoma antibody titer was 1256. Diagnostic suspicion of the infection and the characteristic radiographic finding.
Hey guys, welcome back to Modern and Law. This is quick radiology, and today we're gonna list out the what you call causes for bladder calcification. Okay, so we have two types. Either it could be in the lumen, or either it could be what you call in the wall. Okay, in the lumen, if it's in the lumen, it could be due to calculus, that's a stone, gallbladder stone, or foreign body. Okay, right? Or if it's in the wall, it could be what you call carcinoma, that is a transitional or a squamous cell carcinoma. Transitional squamous cell carcinoma or transitional cell carcinoma, Then we have schistosomiasis. We have tuberculosis and cyclophosphamide induced cystitis. So these are the causes for bladder calcification. Okay, if it's present in the lumen, we cause a calculus, or it could be due to what you call foreign body. If it's present in the wall, it could be due to cancer, transitional or squamous cell carcinoma, schistosomiasis, tuberculosis, or cyclophosphamide induced cystitis. Thank you so much for watching this video. Take care.
Determining bladder volume with Echonos bladder. Please clean the device before and after use, adhering to the user manual protocol. Press the power button. The display will power on within 30 seconds. Select bladder volume. Then select the appropriate patient type. Normal should be used for patients with a BMI under 30, pediatric for pediatric patients 27 kilograms or less, deep for patients with a BMI of 30 or greater, or if scar tissue is present, pregnant for active pregnancy. For this scan, we will select normal. Lay the patient as flat as can be tolerated. If necessary, palpate the patient's pubic bone. Apply the gel and position the probe about an inch above the pubic bone with the orientation marker facing towards the patient's head. Apply pressure firmly. Tilt the portion of the probe in contact with the patient 15 to 20 degrees towards the feet. Select Scan. When the bladder has been found, an orange outline will appear around the bladder. The pubic bone indicator will appear as a green curved line. Maintaining pressure and angle, fan the probe towards one hip until the sound indicator is heard and the arrow appears. Then, fan back towards the other hip until a second sound is heard. Make sure not to slide the probe while fanning. The bladder volume will appear on the display. If the bladder is fully outlined and pubic bone indicator is present, no further scans are needed. Following a successful scan, press Done and enter any requested information. You can either save the scan or discard it. If the bladder is not found right away, the system may prompt you to re-angle the probe towards the patient's head or down towards the patient's feet. It may also prompt you to apply firmer pressure or more gel. Additionally, do not fan too fast or too slow. Maintain consistent pace and pressure during the scan. As a guideline, a complete fan should take around 3 to 5 seconds. If the greater than symbol appears along with the volume measure, there are some actions that can be helpful. Make sure the bladder is centered on the screen and that you are fanning the probe towards one hip until the sound indicator is heard and an arrow is seen. Then fan back towards the other hip until a second sound is heard to capture the entire bladder. Anchor the pivot point to ensure that the probe does not slide in any direction while fanning. If the phrase twisting is detected appears, you should rescan, taking care not to rotate the probe during the fanning motion, making sure the orientation marker remains pointing towards the patient's head. Lastly, if a 0 milliliter reading is obtained, tap the question mark icon. A message indicating possible reasons for empty result will appear. Note, a true low-volume bladder scan will present with a clear pubic bone indicator and a clear visualization of a small empty bladder on the screen. For additional information about using Echonos bladder, visit echonos.com.
Pros and cons. Blood in the urine. Children may become infected by swimming in infested water, while men who are farmers, fishermen, or interrogation workers, and women who are washing clothes and fetching water can also contract the disease. Pros. Some eggs get eliminated from the body in the urine or feces. The calcification is used to help doctors diagnose the infection.
cystoscopy and what it is and what to expect. Cystoscopy is a bread and butter tool of urologists. And what it allows us to do is to see inside the lining of the bladder and the urethra. We can see and learn a lot about anatomy using cystoscopy. Cystoscopy, the word broken down, means cysto, which is the bladder, and oscopy, meaning camera. So simply put, it's a camera looking into the bladder to tell us about your anatomy or to answer a question. It's commonly used to diagnose obstruction and tumors or bladder cancer. Cystoscopy is an outpatient procedure performed in our ambulatory surgery center. It requires no anesthesia, so you can drive yourself and you can eat breakfast. Cystoscopy is a 3 to 5 minute procedure. Most people describe cystoscopy as worse in their head before they get it done than the actual procedure, and that's the reason why I want to talk about it today. The idea of a cystoscopy is very stressful for a lot of people because they don't know what to expect, and that's why I want to talk about it today. You'll drive yourself to the surgery center after eating a lovely full breakfast because there is no anesthesia. You'll check in and the nurse will fill out the customary paperwork and take your vitals and address any other concerns that you have. You'll then need to get undressed from the waist down because that's where the bladder is. We'll provide you with a gown to keep you as modest as possible during this procedure. The nurse will then clean you off with some soap to keep the procedure as clean as possible. And then the doctor will come in, say hi, answer any questions that you had, and then begin with the procedure. The camera used for the cystoscopy is a long catheter with a digital camera attached, and it's put on a digital screen so that you can see, as well as the doctor can see, what's going on. Looking in the bladder takes about 1 to 2 minutes, and we'll talk you through it the entire time if that's what you'd like. Once you're done, we'll let you get dressed, and then you leave. The whole experience is less than a half an hour. Cystoscopy should not be painful, but they feel wet because of the water used to allow the catheter to go in, and it feels like you have to urinate. We do use lubrication in order to guide the catheter in, but no other anesthesia is needed. This is a cystoscope. It is a digital camera that looks like a long catheter and is attached to the digital scope which projects it onto the screen so both the doctor and you can see what's going on. Water is placed inside the port, and it may feel like you have to urinate while you're undergoing the procedure. This procedure is quick and takes less than 2 minutes. The whole time you're here should be less than a half an hour. Side effects of cystoscopy are minimal and rare, but can include mild pain, burning with urination, the urge to urinate, or a urinary tract infection. If you have any concerns in the days following your cystoscopy, please call our clinic to discuss them.
Hi, we are going to demonstrate office cystoscopy right now. We have a patient that was kind enough to volunteer to allow us to film this video with her permission, and we're going to show exactly what happens during office cystoscopy, which is a very simple procedure that your physician may order for you. So we're going to get started now. She's already been numbed. My medical assistant put some numbing jelly into the urethra, so it should be minimal discomfort at all, okay? And I promise to do my best not to hurt you. Okay, so I'm just going to separate the labia here, and then I'm going to gently slip this in. A lot of jelly on there. Okay, the muscles are kind of tightening. Okay, we're past the sphincter. So that's the worst part. And then I'm going to look around. And we do have a monitor that patients can visualize the bladder on the monitor if they request to be able to see what I'm seeing. But otherwise I get a much better, quicker view if I just look with my naked eye. So I'm looking around the bladder. There's water flowing in. So tell me if you start to feel too full, okay? This only takes a couple of minutes. There's a bubble in the bladder, so after we're done, she's going to go to the bathroom and she might feel some bubbles coming out. Looking around, the left side of the bladder is looking fine. Looking looking at the trigone where the ureters, the kidneys are dumping the urine into the bladder. Those look fine. I'm looking at the right side of the bladder. Everything looks perfect. And she has had a lot of infectious-like symptoms and burning. So we want to make sure there's not an ulcer, a tumor, or a stone in the bladder, any other abnormality. So we're done. I've triple checked everything. I know you're probably starting to feel like you need to go to the bathroom, and I'm just about done looking at the urethra. Water off. Okay, and we're all done. That's all there is to it. Thanks.
Issue applied in Ecuador. Schistosomiasis is a parasitic worm disease that transmitted by inhales lying in the fresh water. People became infected with larvae from the parasitic worms are released by fishes, snails, and penetrate the skin when a person comes in contact with contaminated water. More than 2,000 million people carry schistosome infection worldwide. Ecuador has made great strides to control river blindness, so that now permanent blindness from the disease no longer in the theater. Conclusion. Intractite calcification is usually thin and peripheral, and if often described as Hawing and Eggshell appearance. In the case, the most common reason and infection of schistosoma parasite. There must be the correct test to have an accurate diagnosis, therefore discarding other possible causes such as cystite, post-radiation therapy, chronic infection, eosinophilic cystitis, or tuberculosis. Thank you very much.